The following portion of Bloom is sponsored by Gulfside Healthcare Services.
Nursing care and patient navigation can go hand in hand in ensuring patients and families are receiving the quality care they need. Here to tell us more about how Gulfside Hospice can assist in making the hospice journey as seamless as possible is their Director of Patient Care Services, Julia Wise, and Director of Patient Navigation, Kourtney Gabardi. Ladies, thank you so much for being here.
Thank you for having us.
So let's start with the process of receiving hospice care.
So initially, our patient access department receives a referral from a practitioner or a family member, and they usually give us a call. And then our patient access schedules somebody to go out and assess the patients for hospice care. And as long as they're qualified, then we send out an admission nurse and get them started.
And Julia, talk to me about the nursing care provided by Gulfside Hospice.
Absolutely. So our patients come from a wide array of populations. So it's really important for us to be with our patients, see any cultural or religious beliefs that we need to work with them on at end of life, and really find out what end of life looks like for them. And on top of that, not just meet those needs, but meet them in a compassionate way.
And Kourtney, how does Gulfside help patients and families during such a confusing time?
So my department specifically is patient navigation, and we are there to help patients family members navigate through what they need. We can offer private duty care, connections, and placement services, offer them a respite to give caregiver relief.
And I know when someone goes into hospice, a lot of people think, all right, this is the final days. But obviously, it could take some time, and this is where the nursing side of this comes into play to keep the patient comfortable.
Right. The biggest thing is we want their end of life to be how they want it for themselves. Sometimes that can be difficult for families to hear, but it's important for our team to be there, and that's why we have an array of services that we have. To not just be there for the patient, but to be there for the families to make that transition easier.
Yeah, and I think a lot of families, just by nature, because they want to keep their loved one with them, go for all of this critical care and in and out of the hospital. But I read a book that said that hospice care, actually going into hospice care, lets you have more control of your life and your health, and you might even live longer by taking this route.
Correct.
Yeah, that when we are doing the planning, it's very patient-centered. So it's what the patient is wanting, and they can still, have their family there beside them, and I think that's the most important thing for them.
And then hospice is always there for the families, because it is a sad and confusing and empty time in your life. And I feel like when you have hospice care come in and the work that you incredible ladies do, it does help the families as well.
Yeah, our services are offered 24/7. We have just our primary team from 8 to 5, and then we have, it's called Angel Care, that comes on after for if anybody is transitioning or is imminent, that they're there for them, so the family and the patient doesn't have to feel alone.
Well, we really appreciate all the work that you do here in Tampa Bay and beyond. Thank you so much.
Thank you so much.
Thank you.
All right, for more information about Gulfside Hospice and other services available, visit gulfside.org or call 800-561-4883, 7 days a week, 24 hours a day. We'll be right back.
The preceding portion of Bloom was sponsored by Gulfside Healthcare Services.